Hello, my name's Dr. Sarah Heath and I'm a veterinary specialist in behavioural medicine. In this video, we're asking the question, if my pet has a behaviour problem, can my vet help? The simple answer is yes. The reason why your veterinary practice is an important place to go for advice is that some behavioural change can be related to physical disease. So if your dog has pain, for example, through osteoarthritis, or if they have certain what are called endocrine conditions, these can affect your emotions and therefore the way in which you behave. And because the dog is unable to talk to you about how they're feeling, it's really important that you go to a veterinary practice first, and they will be able to carry out a clinical examination. They'll be able to look at your dog. They'll also be able to ask questions about their age and about where they came from and about their experiences, and try to establish the underlying reason why there has been behavioural change. Once those initial questions have been asked, your vet may be able to help you themselves. They may want to refer you to a veterinary behaviourist if they believe that your animal is emotionally ill, or they may want to enlist the help of a suitably qualified clinical animal behaviourist in order to investigate the underlying reasons for your pet's behaviour. Health can have many dimensions. There are emotions, there are the way that you are able to think, there's your physical health. So healthcare is something that involves a range of different people. So your veterinary practice may decide to refer you to a suitably qualified behaviourist. Just be careful, because the word behaviourist is not regulated in any way. So don't just do a Google search for behaviourist, as that won't help you to find someone suitably qualified. What you're looking for is somebody with a suitable qualification, and also think in terms of the potential for them to be accredited in some way. Also think about whether they're a member of a reputable organisation. It's an organisation that has, for example, a code of conduct, some kind of disciplinary procedure, and also thinks about standards for admission of members. Trainers will be very valuable in assisting you in teaching your dog about behaviours that make them an acceptable member of society. So just general manners and behaviour, avoiding problems. Behaviourists will be able to help you with environmental factors or learning that has led to behaviours that are unacceptable. When you're looking for somebody to help you, remember that if they ask you to do anything that makes you feel uncomfortable, it's important to ask why that advice is being given, and if you're still uncomfortable, walk away. For example, anything that involves punishment or confrontation, shouting at your dog or yanking them on a lead. If you feel uncomfortable, it's likely that it's not a suitable way to interact. Modern thinking is that positive interaction is vital in order to train a dog initially, but also in order to deal with any sort of problem behaviour. The question always is, why is the behaviour happening? Just treating the behaviour by reducing its incidence without finding out why is not going to give you a long-term solution. But the first thing to do is to go to your veterinary practice. In some cases, behavioural change is linked to emotional illness, and your veterinary surgeon is the only person who is going to be able to prescribe appropriate medication if that is needed.